Hello, this is Dr. Ron Valdesari reporting from the 20th CROI meeting in Atlanta, Georgia. I'm joined by my colleague, Dr. Laura Cheever, longtime public health leader, AIDS provider, and currently serving as the acting associate administrator for the HIV/AIDS Bureau in HRSA. That's quite a title, Laura, and I know that you're doing great work for people living with HIV. We wanted to talk with you about some of the important work that HRSA is doing, particularly around the continuum of care, or care cascade, as some people refer to it. Could you tell our viewers what we mean when we're talking about the care cascade?
Yes, so the care cascade really is referencing looking at a patient across their entire continuum of engagement in HIV care. So it starts out with all of the people that are infected in the United States. What proportion of those people know they're infected? Of those people that know they're infected, who is actually linked to care? Of those linked to care, who are retained, who are on antiretrovirals, and finally, who are virally suppressed.
Great. And that obviously provides us with a kind of a report card, as it were, as to how we're doing and where there are problems or issues, correct?
Right, and certainly as we have focused more on with prevention with positives, and the issue of antiretroviral treatment as prevention, we want to make sure that people are virally suppressed, because not only does that impact them in their life, but also help prevent HIV transmission to others.
Great. Now, at the meeting, you and your colleagues from HRSA have reported on the care cascade for clients in the Ryan White Care Act program. Could you tell us briefly what you found when you did that analysis?
Sure. So CDC had done an analysis a year or two ago where they looked at the care cascade from all those infected to those virally suppressed and found that only about 25% of people in the United States were virally suppressed. And that's obviously of huge concern to us. Ryan White is a $2 billion federal annual investment in care and treatment. And we know that we impact over 500,000 people infected with HIV. So we wanted to see how well we were doing. We have client-level data since 2010 where our individual providers report data on their particular clients. And we found that overall 70% of people who have ever been to a Ryan White visit, at least one visit in a year, 70% of people will be virally suppressed.
Great. Why do you think your outcomes are better than the national average? What is it about the Ryan White Care Act program that helps keep people in care?
Well, some of it may be data issues, so I want to acknowledge that up front. But certainly in Ryan White, it's a unique program because we not only are providing medical care, but we're providing a full range of services, including substance abuse treatment, integrated mental health treatment at a Ryan White care site, as well as transportation, child care, emergency food assistance, other things that vulnerable populations need in order to be retained in care.
And obviously, I think all of the viewers who are in the field understand more and more we're coming to recognize that although high quality medical care is essential, it's not the only component. As you mentioned, people have to have housing, they have to have food, they have to have stability in their lives. And again, I think many people recognize that the Ryan White program funds the AIDS education and training centers, and the federal government has invested a lot of resources in making sure that our doctors and nurses and pharmacists and social workers have accurate medical information. But I want to underscore what a great job HRSA has done trying to teach providers about the special needs of populations like gay and bisexual men, transgendered individuals, people who live in rural areas. You guys do great work in that regard. Can you tell us a little bit about some of those training activities?
So in Ryan White, we very much expect our providers to take a public health approach to care. So in a private doctor's office, if a patient comes back or doesn't come back, that's not really the concern of that doctor. In Ryan White, if a patient doesn't come back, we expect the clinician or the clinical group that we fund to go and figure out what happened to that patient to get that patient re-engaged in care if possible. So it's a very different baseline approach. As a part of that, there are lots of special populations that we know have huge health disparities. And so our clinics should be looking at those health disparities and addressing them. Specifically, we know that transgendered individuals have some of the biggest health disparities in the nation, so we funded special projects to look at what models of care actually support good outcomes for transgender populations, for example. We've worked with young MSM of gay men of color.
Yeah.
We know that, once again, huge disparities there. How do you engage those people in care and retain them in care? There's not a good evidence base, and we'd prefer that our grantees are using an evidence base. So once again, we've funded special initiatives to develop evidence of best practices.
Great. Well, it's obvious from what you've shared with us, Dr. Cheever, that HRSA is doing life-saving work for men, women, and children who are living with HIV and the family members who are affected by their loved one's disease. So we say keep up the good work, and it's been a pleasure speaking with you. This is Ron Valdesari. We're reporting from the 20th CROI meeting in Atlanta, Georgia.